Hi, my name is Kirsten Brennan from West Liberty University, presenting my dental hygiene senior seminar project entitled Ectodermal Dysplasia, the Successes of Full and Partial Denture Rehabilitation. To introduce my topic, I will be talking about ectodermal dysplasia, which is a disease that children are born with. And this causes sparse hair, it causes their nails not to grow properly, it causes their sweat glands not to develop properly so they can't regulate their temperature. But what I'll be focusing more on is the oral defects that they go through, which is usually tooth loss or lack of tooth development. And the most extreme responses are when they have 6 or more teeth lost, and that would be referred to as oligodontia. Um, and what I will be talking about is how partial and full dentures are the best way in order to help these patients and make sure that they can speak properly, they can eat properly, and that they can assimilate into social life and have confidence in themselves. So my first source is the 2023 article from the Journal of Clinical Pediatric Dentistry entitled Prosthetic Management with Removable Partial Dentures in Pediatric Dental Care case series. This shows patients who are young, about 4 and under, just overcoming their tooth loss and being able to be given a partial or full denture. And in my study, we saw that in case 1, which is exemplified in the top picture that I've provided, the incredible changes that he undergone with his smile and just how different you can see the improvement is. I just thought that that was really incredible to show in my presentation just because it's a completely different change. So I thought that that was great to include. This work exemplifies the struggle of prosthodontic appliances in children due to facial development and frequency of follow-up appointments. So what that means is when adults get dentures, they do not have to come in for refitting as much as children do just because of their developing bones and just, being able to take care of them. So children are going to be coming in way, way more than adults will. They come in about every 6 months. This relates to dental hygiene because despite the rarity of children needing dentures, this is a real problem for people who practice dental hygiene. And just showing pictures like this allows for caregivers to understand just how important the children's smiles are and how important getting prosthetics are to a child. So my second source was the 2022 Indian Journal of Dermatology with their case report, Clinical and Genetic Characteristics of Ectodermal Dysplasia in 4 Indian Children. I thought that this study was important to include just because it shows that ectodermal dysplasia is not just an oral defect that these patients will undergo, it is a fully encapsulating condition. And these patients will undergo an inability to sweat, flaky skin, nail discoloration, thin hair and eyebrows. And as you can see in the pictures that I provided, you can see the oral defects that they'll undergo with the malformed teeth, and then you can see a picture of a malformed nail. And these patients are more likely to develop oral fungus underneath their nails as well. I thought that was interesting to note. But this relates directly to dental hygiene because dental hygienists need to be able to educate their patients on what they should do and next steps to take. Brushing techniques, fluoride usage, and possible prosthodontic or surgical rehabilitation can be necessary. So I think that healthcare providers in all areas should be ready to tackle this condition. Okay, so my third source is similar to my second source, being that it talks about the characteristics of ectodermal dysplasia, but it differs because it touches upon the oral manifestations that these patients will undergo. So in the 2025 article, Morandi et al. Are responsible for writing Ectodermal Dysplasia, a narrative review of clinical and biological aspects relevant to oral health. So this is just talking about all the oral defects that they will undergo, and I just want to read number 2 on my list here, speaking about all the symptoms that they may appear with. So they could have cleft lip or palate, thinner than normal enamel, decreased saliva, contributing to increased incidence of caries, hypodontia, microdontia, anodontia, abnormal tooth shape, malocclusion, and delayed tooth eruption. So this is especially important to dental hygiene because all of these defects can be arrested in different ways, like thinning enamel. We can provide them fluoride trays, and with cleft palate, we need to approach these patients differently than we would normally approach them, and even in children with extreme tooth loss, we need to inform them on the next steps that they need to take, and if they should be getting a prosthetic or if they should just continue to go on with their situation depending on their money situation. So I thought that this was a very important source to note. And this is from the same source, my third source. And this is just showing the development and the timeline that these patients may go through, and the traits that we will see as they grow older. When they're born, it's hard to tell if these patients are actually having ectodermal dysplasia because sparse hair is very normal in children, no teeth. And as they grow older, as you can see in the infancy to childhood to 2 years, when we look at the childhood to 2 years, we can see traits such as fine blonde short hair, dry skin, protruding lips, abnormal tooth shape. These are things that we can see developing over time. So ectodermal dysplasia is something that we might not even know is there until they're just a little bit older. My fourth source gets into the actual rehabilitation process for these children and what goes on during their follow-up appointments. So in the 2022 study by Serenity et al., they wrote the text, Rehabilitation Considerations for Very Young Children with Severe Oligodontia Due to Ectodermal Dysplasia, report of 3 clinical cases with a 2-year follow-up. So this is actually where children are getting prosthodontic rehabilitation. So these children were about 3 years old, and they reported back for check-ins every 6 months over a 2-year period, and all of the patients were pleased with the outcomes of their dentures. In this study, it also noted how the parents of the patients were very happy, and the children were assimilating very well to using their dentures and taking care of them, and the parents were very involved in the process, being that the children were so young. And this relates to dental hygiene because taking care of dentures is one of the main ways that hygienists will educate their patients. So just showing our patients how to properly clean them and maybe even use something like Polygrip to make sure that they stay on properly. These are all things that are very important to helping out our patients, and that doesn't change despite their age. So I thought that this was very important to include. So these pictures are showing the before and after of case 2 in my source 4. This is extremely important, and I think that this was great to look at just because This patient, this is over the course of 2 years. So the beginning, he started as 3.5 years old, and then he was 5.5 years old in this second picture, showing how different his smile looks with his partial denture that they provided for him. He was experiencing oligodontia, as you can see in the first picture. His mandibular ridge is completely edentulous. So I just wanted to show the complete improvement that you can see after this process. Okay, so my fifth source is to act as a counterpoint to the rest of my study. I wanted to include this just because I think it's important to also understand the other modes of treatment for ectodermal dysplasia patients. So this is the 2022 Head and Face Medicine Study titled Effect on the Level of Alveolar Atrophy on Implant Placement, Accuracy, and Guided Surgery for Full Arch Restoration, supported by 4 implants, an in vitro study. So this study is talking about how if someone has a decreased alveolar bone width, it is more troublesome to place an implant and have it actually be successful. So one of the more important quotes that I found within this study was when they stated that implant success rate decreases with the progression of bone atrophy over time. And they also stated that implant deviations increased with increasing atrophy. So this is all to say, as the alveolar bone decreases in width, it is less likely that an implant will be successful. So I think that with ectodermal dysplasia patients, they are known to have a thinned alveolar bone. I just think it would be wrong for these patients to be given an implant, especially with their developing bone structure. I think that ectodermal dysplasia patients should be provided with prosthodontic rehabilitation just because of this fact. And it just allows for these patients to be as safe as they can and be able to take care of themselves properly. Patients with ectodermal dysplasia should be informed that implants are not the best mode of care. So I thought that this was an important counterpoint to the rest of my study. So as my critical analysis states, the research around the topic of ectodermal dysplasia is informative and interesting, but has its limitations. All that to say, I understand that ectodermal dysplasia is a rare disease, so I take that into account. I think that during my research, it was harder to find a large amount of sources, and I can attribute that to the rarity of this disease. So I can understand that. So that was kind of the main gripe that I had with the research that I came across. But I thought that it was very informative, the sources that I did find, and I thought that the studies that I included in my research really showed the differences that these patients will undergo if they go through prosthodontic rehabilitation. Partial dentures and full dentures are very, very important for these patients. So overall, I did not have a lot of issues with this. So in conclusion, ectodermal dysplasia is a condition of missing and malformed teeth. Things such as oligodontia, malocclusion, malformed enamel are all things that we can come across when enduring this condition, and it takes an entire team. Orally, dental hygienists, orthodontists, and prosthodontists, but doctors and primary care physicians should be very, very involved in this process as well because it's not just an oral defect. Prosthodontic rehabilitation, such as partial and full dentures, is the best treatment for these patients, especially the younger patients, being that they are developing and growing and need constant changes in their dentures.
So I think that is the best way to help these patients. And lastly, timely intervention is crucial not only to enhance physical function of chewing and speech, but to improve the patient's confidence and well-being. So, all right, and these are my sources. I just wanted to thank you for listening and learning about this rare disease, and I hope you enjoyed.